Hello. So today we are going to be testing our patient's cardiopulmonary systems. So our assessment is going to include heart rate, rhythm and quality, and then respiration rate to start off. So first, with the patient's arm resting on the table, I'm going to use my 2 fingers to locate the radial pulse. Okay. And once that is located, I'm going to start a timer for 60 seconds. Okay, so I'm going to stop the clock. Because this is our first meeting, I took his heart rate for a full 60 seconds. And then after I took the heart rate, which was 56 beats per minute, I did an approximate respiratory rate where I watched his chest rise and fall for an additional 30 seconds. So I'm going to record my information. Okay, and then next, we will move on to the blood pressure test. So to start off, we are going to, next step, we are going to be taking our patient's blood pressure. So to start off, our patient has been resting for 5 minutes. We have not been speaking to maintain that relaxed state. We removed and exposed the patient's arm, and then now we are going to attach the cuff to his arm on the brachial artery at heart level. Next, stethoscope. We're gonna find his radial pulse. Okay. Now, once the radial pulse is found, we are going to inflate the cuff until the pulse is no longer felt. Next step, now that we've found the approximate systolic pressure, we're going to palpate the brachial artery. We're going to take our stethoscope and place it over the brachial artery. Then we're going to reinflate the cuff to about 20 millimeters of mercury above the approximate systolic pressure. And then we're going to deflate the cuff slowly, and we're going to listen for that first sound that it makes. Then the sound is going to disappear, and then we're going to listen for that second sound. This is going to be the systolic and the diastolic pressure. Perfect. Then we will just remove the cuff and record our information. And then next, we are gonna test his oxygen saturation. So using our oximeter, we're gonna turn it on, place it on a finger that has good circulation over the nail bed, and we wait for a reading. All right, and the reading is about 96, which is good. Record that information. And then last, we are going to test for any lower extremity edema. So we are gonna go to the patient's ankle. We're gonna palpate the inner part of the foot, and we're gonna hold that pressure for about 5 seconds. Okay, we should do it remove the sock first, and then we're going to apply pressure for about 5 seconds. Okay. And since there was about not too much depression, we can confirm that he does not have pitting edema. And that is the Cardiopulmonary Assessment. Next, we are going to be screening our patient's integumentary system. So we're going to be looking at things like the skin's integrity, skin color, skin texture, perfusions of the tissues, and any skin lesions. So to test the integrity, we first want to test the turgor. So we take the patient's hand, and then using your thumb and your finger, you do a gentle pinch of the skin in the back of the hand to test to see the bounce back, which if it's normal, it should bounce back within 2 seconds, which it does. So next we'll be looking at things like skin texture. So touching it, feeling it, observing it, I don't notice any dryness, any flaking, any scaliness, anything of the sort. There's nothing abnormal. In terms of skin color, everything is looking pretty normal. And we just need to test for capillary refill. So by choosing one of the fingers and pressing down on the nail bed, you look for the blanching, the whiteness of the nail, and then the return of color to the finger, which if everything is normal, the color should return relatively quickly. We also will be looking for skin lesions. Since there are none, I don't see any visibly, but when checking for skin lesions, you need to make sure you remember the A, B, C, D, E's, which is asymmetry of the lesions, the border, color, diameter, and if they are evolving. Another thing that should be checked for is any changes in the nail beds. So any redness, any tremor, any turgor, which we already checked for. You also want to look at the shape of the nail, any curvature or clubbing that could be presented in the nail. And then last but not least, you want to check for any scar formation, which doesn't look like there is any old or new scarring.